Hope you're having a healthy day and are excited about this second part of blood circulation for optimal health. In part 1, we discussed the problem with high blood pressure and its effects on our health. Blood pressure is truly the leading, easy to monitor test we can do in order to determine our risks for heart disease, a lower quality of life, and early death. We left off talking about the last, but in my opinion, most important factor of the blood pressure, and it's actually the secret to great athletic performance as well. What is it? It's the importance of your blood vessels being elastic and flexible as blood flows through them. The more flexible your blood vessels, the less chance of high blood pressure you have and the greater athletic performance. In order to understand this, you need to know about something called endothelium. The endothelium is the layer of cells inside your blood vessels. When stimulated by something called nitric oxide, they stay flexible and permeable. But when our diets are bad, animal foods, fats that are fried, they get covered up, these endothelial cells, from these fatty animal foods, and we don't stimulate them anymore with the right nutrients. These two factors lead to early performance decline, poor health, lack of energy, and early death. Nitric oxide is what the body uses to keep the endothelial cells healthy. It was named the molecule of the year at one time, but then people seemingly forgot about it for the most part. Research proves that nitric oxide regulates the muscle tone of blood vessels to have a major impact on controlling blood pressure. Nitric oxide causes blood flow to other areas, helping with things like ED. Nitric oxide stops blood platelet cells from grouping together in a clot to help prevent blockages in the blood vessels. Nitric oxide helps the immune system fight viral, bacterial, and parasitic infections as well as tumors. Nitric oxide also transmits messages between nerve cells and seems to be associated even with the process of learning, memory, sleeping, feeling pain, and even depression. Nitric oxide has been shown to be a mediator in inflammation and even rheumatism. So we know nitric oxide is very important. And there are two ways that the body makes nitric oxide, and you can help with both. Not only is this the secret to lower blood pressure and reduced risk of heart disease, but it's also, as I mentioned, the secret for ultimate performance, used by many Olympic and professional athletes today. First, nitric oxide is synthesized from the essential amino acid called L-arginine, and also partially by the other amino acids in that family, ornithine and citrulline. So arginine, ornithine, and citrulline. These are all amino acids that boost nitric oxide levels. Nitric oxide can be boosted, as the research shows, by supplementing these aminos in the right amount and combination. The problem is that most companies don't tell you how much the studies say we need, and they sell you a low-dose formula, usually just of one of the amino acids. OptiNitric has over 2,000 milligrams of these aminos per serving. Taking between 2,000 to 4,000 milligrams, or 2 to 4 grams a day, is what the research shows is needed to boost nitric oxide and growth hormone levels. Citrulline, one of the amino acids that we've talked about for nitric oxide, is actually found in watermelon. The study done on citrulline from watermelon showed it helped lower blood pressure and improve performance with nitric oxide release. This relationship between nitric oxide led to the ingenious creation of the drug Viagra because of increased blood flow. L-arginine and its benefits, along with the other amino acids, validated the remarkable properties of this amino acid. And in fact, in 1998 Nobel Prize in Medicine, the scientists referred to L-arginine as the miracle molecule. Columbia University refers to L-arginine as the magic bullet for cardiovascular system. Columbia's researchers have compiled over 10,000 citations, 10,000, to even include L-arginine as its course material. The research is phenomenal. It shows in studies that L-arginine, along with citrulline and ornithine, can stimulate growth hormone for anti-aging benefits, helps to counter heart disease, aids, as we're talking about today, in blood pressure regulation, improves insulin sensitivity to help normalize blood sugar, bolsters the immune system, boosts energy, and increases lean muscle. We know that L-arginine is a precursor for the synthesis of nitric oxide, this important molecule we're talking about, but it also promotes reproductive health, and many people use it as a natural alternative for Viagra. We know that by providing these specific amino acids, there's a pathway the body uses to actually increase nitric oxide. Remember, L-arginine is not a hormone and it's not testosterone. This is important knowledge for athletes. L-arginine is an essential amino acid. When properly brought into the body, it can cross the blood-brain barrier to signal the hypothalamus to naturally trigger the pituitary gland to produce growth hormone. This is the key to eliminating any negative side effects. So the first key to nitric oxide is through arginine and the other amino acids, ornithine and citrulline supplementation. The other pathway is not well known, but is important because as we age, it becomes harder for arginine and the other aminos to work unless they have antioxidant support. That's the key. A human clinical study recently performed on an antioxidant blend proved that the optimal health systems, fruit and veggie plus powder consisting of over 35 phytonutrient-rich foods from 15 different countries, boosted nitric oxide levels in humans. So the 20,000 plus antioxidant power increased nitric oxide through a different pathway than the arginine and the other amino acids. It's called the nitrate pathway. Researchers theorize that the reason for improved athletic performance is due to an increase in nitric oxide production via this different pathway, other than the traditional L-arginine nitric oxide pathway. This process is called the nitrate-nitrite nitric oxide pathway. That sounds kind of funny, but basically fruits and vegetables have nitrates that convert down to nitrite and then nitric oxide. And when it kicks in, the oxygen levels actually are able to be utilized at a higher level. So we know that through this pathway, through many studies, that athletes can actually improve performance by getting more use out of the oxygen they consume. Many studies exist showing that the ingestion of special fruits and vegetables high in nitrates that convert to nitric oxide improves this performance. Here, cycling times were increased with nitric oxide boost from just fruit and vegetable juice. This study shows less oxygen being used so that higher intensity and energy can be created for athletes for extended period of times. What a great concept. Longer energy and more endurance from the same amount of oxygen if you have nitric oxide being boosted through the fruits and vegetables we take in. Nitrates are helpful to athletes because they quickly bring oxygen to muscles, essentially making them more difficult efforts easier. Many athletes enjoy the vascular increase with nitric oxide also. So what do you do exactly for boosted nitric oxide for performance and to nutritionally support better blood flow, lower blood pressure, and to help nutritionally support reduced heart disease risks? Take 2,000 to 4,000 milligrams a day of an amino acid combination of arginine, ornithine, and citrulline. And you might want to use a time-release arginine like AAK that works great and optinitric. Then also get out your juicer at least once a day and use dark greens, beets, and fruits. Add a serving of the Fruit and Veggie Plus for the additional nitric oxide boost as shown in the human clinical trials. And those two combinations will boost your nitric oxide levels, keep your blood pressure lower, help keep your veins and arteries more permeable. That's it. Monitor your blood pressure before and after trying this protocol. And if you missed a part of this two-part video series or just want a printout of the information and the protocols contained from the research, call us at OHS at 1-800-890-4547 to get your free copy. Have a healthy heart pumping day.